Thank you. Good morning. It is the Incarceration Prevention and Reduction Task Force Legal and Justice Systems Committee. It is 11:30 on November 12th, and I'm going to begin with the land acknowledgement statement. Before we begin, we acknowledge that we are gathered on the traditional and unceded territory of the Lummi, Nooksack, Samish, Semiahmoo people who have cared for and tended this land since time immemorial. Truth and acknowledgement are critical to building mutual respect and connection across all barriers of heritage and differences. We begin this effort to acknowledge what has been buried by honoring the truth. We pay respect to their elders, past and present. Please take a moment to consider the many legacies of violence, displacement, migration, and settlement that bring us together here today. And please join us in uncovering such truths at any and all public events. Well, thank you all for joining us. I'm assuming we'll have a few more pop on as we continue. I am going to call the meeting to order and begin with re-entry demonstration initiative, which will be presented by Chief Caleb Erickson and Nicole Kalin.
Good morning, everyone. My name is Caleb Erickson. I'm the Chief Corrections Deputy for the Sheriff's Office. And with me is Nicole Kalin, who is working behind the scenes to make a lot of this stuff possible in coordination with Health and Community Services. So I appreciate her support. She's going to be on standby in case I say something that is inaccurate or that if I have questions, I'm going to be leaning on her. So the 1115 demonstration waiver is intended to be a reentry project initiated by Apple Health or Medicaid, and its focus is entirely on corrections and bridging the gap between in custody and incarceral setting and integration with the community. And over the course of the last 6 to 8 months or so, the Sheriff's Office, in coordination with Health and Community Services and the Executive's Office, has applied to be in cohort 1 of this reentry project. And we're working our way through a series of milestones. So the reentry project itself is divided up into 5 milestones. And at each milestone, there is an award given to participants in the cohort that is intended to support the efforts that the agency is going through. Right now, we are on milestone 2 out of 5. Milestone 1 was essentially showing intent to participate. And milestone 2 is developing a budget for the spending, both really for the state level, submitted to the state level. As you can imagine, the county side of that budget is a little bit more nuanced, whereas the state just looks for how much money in total we're going to spend on each of the milestone awards. The initial outlook for the tier that we're in, because it's a tiered system based on the total population of your facility, is $2.5 million over, I believe it's 3 years. So 1 million of that is dedicated to IT related projects to support this effort, and the remainder is for other supported things. So early in this process, we identified that we needed to do some research into what systems exist and are they functional, or are there updates that need to be done in our healthcare and behavioral services. And we've begun a contract with the National Commission on Correctional Healthcare, or NCCHC. They have an arm that focuses on evaluation of systems like ours to determine what's best path of travel moving forward for jail health and mental health services. So we expect that that project will wrap up in February of next year, so giving us an idea of direction of travel for our jail health and physician services. And then that will lead us into the body of work that we're doing for milestone 2, which is getting ready essentially to sign people up for Medicaid. The goal being, reentry services for this entire initiative. So essentially taking the services that are available in the community and the people who are incarcerated and bringing those two things kind of together and in closer proximity. The methodology for which is maintaining some people on services that they're already enrolled in Medicaid. In addition to that, in enrolling people into Medicaid, even if they're incarcerated. And then there are certain services that are done in custody now that could potentially be reimbursed through Medicaid. And that certainly is something that's an incentive to the county to continue on in this process as soon as we can. So that's essentially the framework for the project. The challenge that we're seeing right now is that the reentry initiative was really designed for, I think it had most in mind for either larger facilities or Department of Corrections, where everybody's sentenced to a period of time. Some of the metrics that we're having to work with is they talk about last 90 days of incarceration in terms of eligibility. It's hard to tell what your last 90 days is going to be in a jail setting, especially when our average length of stay is around 18 and a half days, and not everybody's sentenced. So we're still working through some of the nuances of what the expectations are from the Healthcare Authority of Washington State and what we can accomplish here at our local region. There are kind of 3 primary must-dos if you're going to be involved in this process from a county's perspective. I'm going to go to my notes because I don't want to forget them. But essentially, they are ensuring that everybody who is incarcerated has the opportunity to be enrolled in Medicaid. You must provide them 30 days of medication at release. That's something that rolls off the tongue and is easy to say, but it's much, much harder to actually accomplish. And I knew I was going to forget one. We'll come back to that, but essentially the hardest thing about having 30 days of medication is every single person that you're going to release then must have 30 days of medication. That's a really tall order. And physical plant limitations, being able to get that much on hand is very complicated. In addition to that, as I mentioned before, with the focus being on Department of Corrections, initially, we really have this moment where we're just not able to accomplish some of these agenda items for the initiative with people who are here for 12 hours or less. And so we're really going to have to dial in exactly what services, if any, we can accomplish in a very short period of time for people. It may be just checking for eligibility and enrollment. It may not even be that complicated, depending on the circumstances for the individual. So additional to that, we have to worry about integration with a local healthcare record system called EPIC, which is used at the hospital and many providers in our community. And it actually is a really good standard to adhere to because EPIC is in a lot of places. And it gives us the best advantage when it comes to continuity of care, communication, and so forth. But again, it's easy to say, hey, we're switching to EPIC, but it's much more challenging to make that a reality. So we can say for sure that the switch to EPIC is going to take more effort than we've certainly spoke about so far. It's an IT involvement. There's going to be involvement from the people on part of EPIC and additionally with the state. From what I recall, we are not required to go to Epic, or I don't know that that's even going to happen until 2026. And so that's where we're looking for guidance for it in terms of the time frame. I pulled up my notes, and there are a couple more things that are mandatory services. And so we're going to go back to that idea. And so there is a mandatory inclusion of case management. So people who are case managers for individuals who are being released, being able to track them and where they're at in the community, as well as when they're in custody. And then having medications for alcohol and opioid use disorder as part of the package for all of these people. And that currently, the medications at least is currently being done anyway. Optional services include medications during a pre-release period, lab and radiology services, and then physical and behavioral clinical consultations. So having additional providers coming into the jail setting, and then services by community health workers with lived experience. So those are optional services that we're going to provide as well, and those are part of the timeline. So in terms of the timeline, the earliest that we can expect we'll be able to enroll people into Medicaid is in July of 2025. They've moved the milestone timelines back a number of times. And so we will likely not be ready in July of 2025, at least not for every single person. We may have some components that are ready, but there's a lot of work to be done between now and when we start in earnest getting people enrolled. It's an exciting time because I think that there's some real thirst in this population for having this. I've had some conversations with individuals who are incarcerated, and they're going, you know, what would really help me is being enrolled in Medicaid before I get out of here. And so it is kind of an exciting opportunity, and we're really thankful to be involved in the first cohort for this. A lot of work being done by Nicole and others to make this happen. So really appreciate all of their intentional focus on this. And it again, it's a really exciting opportunity. I think those were the broad brushstrokes. Does anybody have any questions?
Stephen.
Caleb and Nicole, thanks for getting this going. My understanding is that there are some exceptions, but mostly Medicaid services are provided through enrollment in one of several health maintenance organizations. So you talk about the services. Are there links being made? Are there commitments already made from the managed care organizations to be ready to take enrollments and actually have a network capable of providing all these services?
Yeah, it's a good question. In specificity, I can't say a particular organization, but I know that, for example, our partner with pharmaceuticals has to have a particular level of readiness in order to be ready to do this. And they are aiming for that. And I think that they will be ready for that partnership. In terms of local providers, I'm not sure, but you're absolutely right. Some of the things that are reimbursable will simply be reimbursable for services that we're already providing. You know, for people who are in custody and providers we're already working with. So those are some things that we're going to have to work through as we move forward, but certainly want to be ready for some of these managed care organizations being able to provide those services and to have that integration.
Just to follow up, Caleb, do you know, or Nicole, do you know, is the Healthcare Authority going to require managed care organizations serving Whatcom County to participate in the pilot?
I don't know. Nicole might.
They're not requiring it at this time. The only thing that they're requiring is that they have to accept Medicaid, which a lot of our providers already do. And then to the previous question, we're also working with ACH North Sound ACH, which was a pilot program a few years ago that is a hub that we can use. So we are tapping into those resources as well, because they already have a lot of resources set up. So we're in the process of merging to and setting up referrals to start sending people their way already. Those will be more for services once people are actually released. But all doctors anyone helping with services would be required to be Medicare or Medicaid enrolled.
Marty Raylene called for you. She was just muted.
Oh, I didn't hear that. Yes, I just want to say an enormous thank you. I mean, this is really a giant lift, as you said, especially to be in the first cohort where you're kind of figuring out all the logistical nuances for everybody else that follows. And it's an excellent service. You know, as a physician, of course, I'm highly enthusiastic, but for the community in general, it is wonderful to be able to offer them Medicaid during part of their incarceration and on release. So thank you for all your hard work in this department.
Thank you. Yeah, and the sheriff's focus has been very much on reentry services and getting people the integrations that are necessary for success and to reduce recidivism. And certainly our community focus is very much on that same topic. So.
Thank you, Caleb and Dr. Safford. Stephen.
Caleb, I'm sorry, one more question. You mentioned case management and tracking as being a critical component. I certainly agree with that. Is that being provided on the county level internally to the jail or the correctional system, or is that being provided by the managed care organizations gatekeeping Medicaid services?
Yeah, that's a good question, and Nicole may weigh in on this. We have already services in place, like our reentry team through Lifeline Connections and a medical navigator through Northwest Regional Council. So the award money is not allowed to supplant work that's already being done, meaning we couldn't pay for services that we're already doing. So anything that we're using the award money for will be above and beyond that. But we don't think that this should be a limiter, right? In terms of like, the award money is just the award money. It will run out. We want to be able to continue these services beyond the scope of the project. So we envision it being kind of a combination of both, where we have services at the jail where people who are incarcerated have literally those integrations where they're at, and they continue through when they're in custody. And that certainly is a system that is set up now with the Lifeline Connections reentry services. But there is potential to expand that. Again, as we focus on just simply medical need, there's a higher need than what I think we're currently funding for that reentry work, just specifically on people who are medically necessary. But honestly, like I look around at our population who's in custody, and it is ready for additional reentry services. And there are people who could benefit from reentry services and likely would not recidivate if they were to get those services. So again, I'm very hopeful for where this takes us, and hopefully that answers your question, Stephen, or Nicole. If you again hear some deficiencies in what I'm saying, you can jump in.
No, I think that's exactly right. I think the case management isn't necessarily on the Medicaid level. It's more on the jail level, so to speak, and making sure we can get those connections to those people on the outside. And then that's again where the North Sound ACH is going to come into play for us.
Caleb, Nicole, is there anything else that the Legal and Justice Committee or the task force as a whole do you think can assist in making sure this moves smoothly?
It's hard to say. Oh, sorry. Bertie, you had another question, maybe?
Yes, but go ahead with this one.
Well, it's hard to say. I think that we have a good team of people, and we're moving in a good direction. We have, limitations with county resources, right? So, our IT staff is constantly dealing with too many things at once, as far as I'm concerned, and that's just the world according to Caleb. But so they've got a lot on their plate, and certainly they're aware of all the things that we're trying to accomplish in this. But it might require more effort or more assistance than they currently have, meaning more staff potentially, or some contracted staff. From a standpoint of what you can do, I'm not sure, but I'm willing to take advice, or if there's something that you think that is deficient that we could use assistance on. We're more than happy to. I see the sheriff is unmuted. Potentially he's got some things.
Yes, and I'm sorry I'm off camera, but one thing I will say is that, as you can imagine, being part of a new program and the first cohort, there's actually some benefit to being part of the second cohort, because you're actually looking at things that could be improved in the first cohort. But I will say that HCA does have, I believe it's monthly check-in meetings with Nicole and others. So, and then the other participants in the cohort, we actually get a chance to listen to them as well to see how they're progressing. So it's in progress, and we'll definitely give updates as we go forward.
Thank you, Sheriff Tanksley. Bertie?
This may be too detailed a question, but I was thinking about the tribal members that make up part of our jail population, and traditionally their medical care is funded separately through the national medical system for tribal members. And I was curious if that's going to become an issue. I believe they're eligible to choose. So I was just wondering, I'm sure you're addressing it, but since they're a significant part, I understand, of the population, I was curious about how that would impact it.
Yeah, my understanding is the same as yours, that they could choose one or the other. If they're already enrolled in Medicaid, then that is something that we can continue. But yeah, we're gonna have to do this on an individual basis.
Got it. Okay.
And Bertie, I'll add that separately, we are looking into a program with Lummi Health to possibly have their doctors and nurses come into the jail to adhere to actually give some services to their tribal members and other tribal members. In fact, we're meeting today at 3 o'clock to further that conversation. So that's a separate program that we're looking at instituting. So yeah.
That's good. Thanks.
Thank you. Stephen Gockley.
Should be apparent now that you have two Medicaid wonks between Bertie and me here, so cut us off if we get too far into the weeds on this. But I want to go back to your comment, Nicole, on case management, where I think I understood you to be saying case management would be done in the jail, and then you'd sort of hand off to the ACH. And my understanding of the ACH is that it's not a service provider. It funnels money. It's the hub of, but the spokes are the providers. So I'm wondering, what exactly role are you seeing with them, if that's actually the case, and how are you assuring that those case management services, if there's a couple steps out to that, how are you tracking the tracker there out in the community for case management at the quality level that you want to have?
Yeah, so that's a good question. We're still in early talks with ACH. As far as how that transition is going to work, what we know is right now they're able to help with services while we're still trying to get the re-entry initiative going. So we can lean on them for those services. They do funnel some money, but they can also help us get other additional contracts with ideal options or whatnot in place as well. So we're kind of leaning on them in multiple roles on which way they can help us. And like I said, those talks are still early, but the fact that they already have some of those referral services in place that we can start using now, I think would be beneficial in the long run.
And then additionally, I think that the case management that's being done now is a good model to use. I don't think there's anything wrong with the case management that we have. I think that, again, it could expand and potentially the application of who the clientele is for our case managers could expand, in my opinion. And we wouldn't be hurt by that in any way. It's just a matter of having resources and the additional capability for that group, because again, they're doing excellent work. We just need more, and we need a broader application of who's eligible.
Thank you for your presentation, Caleb and Nicole. Are there any other questions in reference to this? Caleb, you said you were going to take the whole hour.
I said it was dangerous to let me just talk freely, but
Did great. So the next item on the agenda is review the draft year-end report. And if there's anything that anybody wants to bring to our attention immediately, we can do that. I'm not going to go through pages 1 through 24 to have you guys scan through it here on the meeting. But if there is anything that you feel that we need to make changes or adjustments on, we can either talk about it right now or make sure you bring it to Jill's attention so we can make amendments as needed. Okay. I'm giving people an opportunity and I'm not seeing anything. So just make sure you reach out to Jill if there's any amendments to the year-end draft. Is there anything else on that, Jill, that I need to mention?
Nothing from me, thank you.
Perfect. Okay, so case processing timeliness and efficiencies, we were going to continue that on from the October meeting, and I'm open to suggestions. I can tell you timeliness and processing is definitely got a wrench thrown into the works just recently. As we were told on the 4th of November that the judicial court case management system had been compromised and is not accessible to any of us at this time. We are trying to utilize other systems as well as lots of Excel spreadsheets. We're getting help from IT to scan stuff so the judges can review things, but it is delaying the court processes from the Superior Court administration and the clerk side, as well as juvenile and district court and courts of limited jurisdiction. So we are all trying to do the best we can to operate without a case management system. We have learned from the state that they are cautiously anticipating that we may be back up and running on the 18th, which we're hopeful for. We are not sure if that's going to happen. I am working with the county executive as well as our civil legal department to assist us on an emergency proclamation. We will be asking the state for reimbursement due to the cybersecurity issue. They anticipate that there will be some assistance from the state, but have not given us an answer of how much. So we will make sure that we send any invoices their way. But that definitely kind of puts a wrench in moving forward until the case management system is up. I want to give a shout out to Eric Ritchie and his team with their case management system because that is helping us with calendaring for criminal matters. We're just going slowly and cautiously. Any questions on that? Thoughts?
So I'd kind of like to add to that a little bit. I think people are kind of also wondering about resolution rates, and I have some good news. I'm not sure everybody's heard it, but we were able to use our case management system, and we have determined that we are actually resolving cases faster than we're charging them. It's good news. Things are that's happening both in Superior Court and District Court. Yeah, right.
Excellent. And to add to that, we currently have 3 trials going in Superior Court this week. So,
Yeah.
you know, we're moving things forward the best we can with what we can do. And other things are kind of at a standstill. But we can pick up on this a little bit more when I can actually do some research and look up things. But yeah, can't do it right now. Any other thought? Oh, Stephen.
Eric, are you improving resolution rates because you're pleading out more cases? What's the dynamic there that?
Well, most of our cases do resolve through pleas, and so it has to be more pleas. Although, you know, trials and forcing trials and getting ready for trial is what makes pleas happen. So it's really hard to say. Little chicken or the egg, if you will.
Any other questions or comments?
And just to be as clear as I can, Stephen, we are pushing cases to trial. At least, you know, we're all rattling swords more than we have in the past, and I do think that's making things happen. I don't know if Maya's got any thoughts about that at all, but I really do think that's a factor.
Oh yeah, we're definitely trying cases, but you know, and I would love to know more about like what number of dismissals are happening, what number of pleas are happening, and what number of trials are happening. And this afternoon, I know our office is meeting with IT to talk about data and what it is we need to be gathering and what resources we have to actually do that right now. And I'm hoping, I emailed Eric just now asking him to share his figures with me, and that would help us in our discussion this afternoon too. So yeah, I don't have a clear answer for that.
Yeah, so even to be more clear, pulling data is hard. It's complicated, and it's not something that is just ready-made for every case management system. And what my people were able to pull was over the last 9 months that our filing number is actually lower than our resolution number, and that's remarkable. So we're really happy about that. And it's lower by about 100 cases per division. So it's slow, steady resolutions rates being improved.
Thank you. Any other thoughts, concerns moving forward? I think we'll have to revisit this topic again because I think there's a lot more work we can do, but I don't know that I'm going to be able to do more on it right now, but I really appreciate Eric and Maya and their assistance and timeliness. Bertie? You're muted.
Yeah, okay. One quick question. I'm always the data questioner. When the case management system from the state is back up and running, does that help you with the kind of data that you and Maya are talking about with sort of overview of types of resolution, how many pleas and all those things? Or do you need additional systems in order to get kind of that level of detailed reporting?
Well, I think it's a little bit of both. I mean, we can run reports through the case management system that tells us how many cases were charged and when they were resolved, or the time from the filing date to the end date. It doesn't necessarily always give us the answer whether it was a plea or a judgment and sentence because of a trial. We can work with that. AOC is very helpful and creative in creating reports that give us some of that information. Some of the data we're not necessarily going to have, but we can at least attempt to do that. Right now, we can't do any of it.
Right.
And that's just because it's affecting all of the courts.
Mhm.
But I can say with other systems such as PBK that the prosecutor uses, they're able to pull different data. So different systems will be able to assist in that. You know, Caleb, they have their own case management system for the jails, so they can use Spillman to look at, you know, how long somebody's been incarcerated. So all the different silos have to work together to provide accurate data. And one of the major silos has fell over.
Yeah.
I'm going to add to some of that as well. I really, I can't even say how much I agree with Raylene about how the silos are different and how different data can be only collected from that silo. I don't know whether people are pleading guilty from in custody or outside of custody, and I wish I did. But we don't collect that in our system. Now, with that said, I think it would be a good idea for those interested in data to give us a wish list and tell us, what it is that you'd really like to know. And, maybe we can start getting that stuff input. It's, yeah, I mean, our system is, it's heavily people oriented. I mean, we have to set it up by hand and such, but if there's something
Right.
you really want, and you should tell us, and we could do what we can to get that gathered for the future.
Caleb and then Maya.
I realize I'm not even part of this meeting, but I just want to make sure if you have questions, I'm available. And I was just wanted to point out that the systems that we're all integrating with and these systems that we're talking about, the silos, we're not designed to get the information out of them that we're asking of them today. The challenge that we ran into is if we wanted to know the answer to a question, whatever that question is, you almost had to know that when you set the system up. Because we're going on 11 years of use with Spillman,
Right.
and if we didn't kind of designed it into, hey, we're going to track this, or we're going to want to know this answer 11 years from now, we're not getting the answer even routinely. And it's hard to switch too, right? If I tell everybody who's putting information into the system, I want you to switch. Well, at what point did we switch, and what data are we now tracking that's different, and how are we tracking it differently? And
Right.
everything that you kind of tweak just a little bit sometimes has consequences that you don't understand. For example, this is just a for instance, about 4 years ago, the state changed the codes that we used to track. Originally, it was a race code that had an ethnicity ability. So you could say, Caucasian with a Hispanic ethnicity, and they took all of the codes out for ethnicity. So we lost all of the records up until that point because all of the codes changed, right? So there are things sometimes where we're told to track something at a state level that changes the data that we're capturing literally in real time. And you have to kind of go, okay, well, at what point did that change, and how much data was lost as a result of that? And that's just literally one field over the spectrum of things that we categorize. So it can be really challenging to say, well, we really wanted to know that information. It would have been helpful for us to understand the ethnicity of the people who are incarcerated, but we lost all that data.
Yeah.
Yeah, so like at our meeting this afternoon, these are the conversations we want to have. Like, what are we looking for? Do we have the means to collect them? And in 2021, I think I did a public records request of King County for their Defender dashboard data, and I have like 95 pages of charts from like the 1 month, like from snapshot, and it's like 95 pages. So I'm gonna pull that up at our meeting this afternoon and be like, what of these this amazing collection of data and charts do we want, and how can we get that? I mean, it's like it's a full-time job for somebody. So I mean, like, we're going to start by having these meetings, but I like the idea of hearing from the public, hearing from this group, here's the data points we're interested in. We're going to be brainstorming that this afternoon, but there will be things that we miss. So I don't know, have we changed the index committee so much that it doesn't really do this anymore? I don't even know, but if that could be like a task, that would be cool to have a list.
Bertie?
Yes, I think that that really does need to come back and energize the index committee. And I think there's some work just beginning to look at some best practices around the country in terms of what type of data is used to track these kinds of things. So I appreciate the value that would give to all of us, and particularly you in the court. And all I can say is we're starting to look at that, and hopefully we can be useful in terms of the reality of timelines and not give you something elegant in 5 years, you know?
So Bertie,
So-
you are meeting and discussing that in the index committee now?
Yes, we are. We have a meeting December 3rd. We meet every other month, but we have redone our mission. And one of the requests is please give us recommendations.
What time is that meeting on the 3rd?
It is to, Jill may-
Yeah, it's December 5th, actually.
Oh, it is. Sorry.
Okay, great. I have that on my calendar. Perfect.
Okay, yeah, sorry about that.
Great, no problem.
That's why we have Jill.
All right, Eric?
Yeah, so Bertie, one thing that you need to know is that the health department is gathering a bunch of information as well. And
Yes.
they're mining our case management system to get that information. We've signed an agreement so they can reach into our system and gather the information that they need or want for whatever tracking they would do. And I think that they've have agreements with the sheriff's office and the jail. They're working on BPD and maybe some others too. So you know, the index committee needs to know that.
Thank
because,
you.
yeah, as a starting point, there's going to be some information gathered, and you may want to chime in on what that is.
Yes, thank you. We are trying to work closely with the health department, and so that's really important. Appreciate it.
Thank you, Bertie. You know, one thing that I noticed before I came into this role is that the naming of different areas is so important. And when I was looking for data before, somebody asked for how many citations were filed that were issued from somebody on Portal Way. Well, when I pulled that up, I had to look up Peace Portal, I had to look up Portal Way, I had to look at Peace Portal Drive, because every officer was putting down a different street. And so when you're trying to pull and extract data, if the naming fields are not the same, then you're not going to have accurate information. So that's just something that we really need to work on as a whole. And when we're doing stuff to make sure that everybody's using the very same naming field so that the data is more accurate moving forward. I know this kind of moves from timeliness to needs from the index committee, but I think they kind of tie together because how can we know what's timely if we can't track the data? So I appreciate this conversation. Any other comments or concerns in reference to this? I see Caleb.
Well, I don't know if it's off topic or not, but you know, since the beginning of the year, the sheriff has really focused on transparency in, you know, operations and being clear about what it is that we do. And for a long time, it feels, at least to me, it kind of felt like the community was saying that what goes on in the jail regarding data and who's booked and who's not, and as it relates to index is a bit behind a wall. And the sheriff has focused intently on removing those barriers and coming up with solutions that will be forward facing and publicly available. We've got a dashboard that is in final stages of preparedness that is actually based on something that Heather brought up in a meeting it's been a couple of years now, Heather, I can't remember how long ago, but pointing us in a direction of another agency that had a model for us to use. And so we've taken a lot of that information, and that has also influenced my quarterly and annual reporting that I'm doing for jail services. So you can expect to see that the reports that we're creating are already doing better, but we're working to push that limit and the line in terms of transparency and showing our work on that through
Excellent.
reporting. So
Thank you, Caleb. Any other thoughts or comments on this topic? Okay, we're gonna move to the last agenda item, which is we have a joint behavioral health meeting next. And so is there any topics that we should be addressing at that from the legal and justice, or that are combined that everybody thinks needs to be on there? Stephen.
Yeah, Raylene, I just wanted to let you and this committee know that the Behavioral Health Committee has been discussing, thanks to a suggestion from Dr. Wu, a model reentry program out of Los Angeles, Homeboy Industries. Dr. Wu has visited them. They, I don't want to say franchise, but they consult and support similar programs elsewhere, and there are some variabilities there. There happen to be a couple of Washington counties that have connected kinds of reentry programs, one of which is in Skagit County. So we're hoping, we've contacted Jill to have that on our agenda for the joint meeting, because I think the overlap is obvious with this committee, and I just wanted to put that on the table for our recognition of an agenda item.
That's excellent. Stephen, if we have any information that can be passed around to some of the Legal and Justice Committee members before then, so that if we have questions that we can prepare for Dr. Wu or anybody presenting on that, would be helpful. Is there any other topics that we think that we want put on specifically from Legal and Justice that interact? There's so many that I can think of, but my mind is also not where it should be today. Right, I'm not seeing any comments on this. So if we do, if anybody thinks of any other agenda items that we want to discuss at that meeting, that would be great. Just prior to this, we were talking about data and timeliness. That might be something that we want to bring up, so that we're both thinking of what they want from both committees. But I do see Caleb's hand up, so I'm going to move to him.
I might be speaking out of turn, so the sheriff can jump in if this is not appropriate. But I want to make sure, what was the time frame for this meeting? When is it?
I think it's the second week of December,
Number 10.
December 10th.
Okay. I wanted to at least, and I may follow up with an email, pending whether the sheriff is okay with it or not, have an opportunity to talk about a pilot program that we're doing for the work center and reentry and behavioral health. So it would be potentially a good opportunity to report out on how we're doing and what that is, and if you aren't all aware. So
Stephen?
Yeah, just following up on the data question, you know, earlier in the conversation, Eric emphasized the work of the Health and Community Services Department on MOUs to share information. I knew that. I know absolutely nothing below that thin surface description. I wonder if some sort of presentation of what that project actually is and the kind of information that's being gathered, because one of our ongoing concerns has been how to integrate health-related information and criminal legal related information. And so if we could understand more about what that project is supposed to look like and where in the work plan they are with that, that might be a topic for either this meeting or the next joint meeting.
That sounds great, Stephen. Any other thoughts? All right, I'm gonna move to other business. Does anybody have any other business? All right. Seeing none, I'm gonna move to public comment. Jill, do we have anybody in the public?
We have 2 attendees. If either of you would like to speak to the committee, please virtually raise your hand now. No hands are raised, and I don't see anyone attending in our conference room. Thank you.
All right, thank you, Jill. Well, if there's no objection, I'm going to adjourn early. It's 12:23, and have a great day, and thank you for your participation.